Brian Muldrow is excused, but legislator Elaine Daly, legislator Bob Shea here, legislator Tom Winslow here, and Heidi Nightingale, I am here. I'd like to start by standing and pledging allegiance to the flag. Pledge allegiance
To the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. So first on our agenda are minutes to approve for the December 3rd, 2024 meeting. Thank you. A second?
Second.
Any questions or discussion? Hearing none, all in favor?
Aye.
Any opposed? Those pass. We have no appointments. And I would like to, on this particular agenda, skip down to Deborah Dennis, who only has one. This is the very end of your packet. HH 20. I know that's a daunting number. But some of them will be bundled as contract renewals. Would you like to come up and present and discuss with us? Either, yeah, probably the podium's most comfortable.
Good evening. My main update has to do with my resolutions today. The Youth Bureau program contracts for 2025 have all been voted on, and they were approved at our Youth Advisory Board meeting on December 2nd. We have 14 programs in Cayuga County totaling $106,000 in funding, 4 of which are brand new programs that the Youth Bureau has not funded in the past. After we go through contract, if everything passes, I will be working with a new program specifically on the contract process, evaluation, and the reimbursement process. I have one resolution this evening, and this is actually for all of the contracts for 2025. In the past, I've split them up, but this year, since we were able to get it early before the first part of the year, I have all of them to present as a resolution this evening.
Can I have a motion on HH 20 before Deborah moves on?
I'll move it.
Second.
Thank you.
I do have them sectioned off because we have 3 different revenue sources of funding. The first one is for our youth team sports. We have Auburn Lacrosse Boosters, Booker T. Washington's recreational basketball team, our basketball program, Cato Youth Soccer Team, and the Auburn Stingray Swim Team. The second grouping is for youth development programs and Auburn School District's Passport to History, Booker T. Washington Summer Camp, Camp Casper Gregory in Aurora, Chad with doing some learning objectives in the Auburn Enlarged City School District, Longhouse Council Scouting Program, Meridian Ira and Cato Summer Recreation Program, as well as Perform for Purpose. And the third one is for youth sports and education. These are recreational sports opportunities that are not youth team sports. This goes for Auburn YMCA to do summers to continue their summer swim lessons they offer at Casey Park Pool for free. Town of Brutus Summer Recreation Program, as well as the Cato Recreation Center offering free swim lessons.
Thank you. Any discussion on this resolution? Questions for Deborah? Hearing none. All in favor of HH 20?
Aye.
Aye. Any opposed? Passes.
This is the balance of all the money you'll get for the year. This is your OCFS allocation.
And then 15% of that OCFS allocation was held back for Youth Bureau administrative costs that we put into our.
Towards your salary. Yep.
Thank you, Deborah. Okay, so now we'll move back to the regular order, but I'm going to go in order of how they're presented in the packet. So we will have Kathleen Cuddy.
Good afternoon, everybody.
Happy New Year.
Happy New Year. Would you like me to go through the resolutions or give an update?
Let's take care of the resolutions and go through your updates.
Our first request is to enter into a contract with Aurora of Central New York for interpretation services, primarily sign language.
Okay, so this is resolution HH1. A motion?
I'll move it.
I'll second.
Thank you. So discussion and
There are, I believe, with the resolution, you may have received contract rate sheets. If you did not, I do have interest in. We've been fortunate. This is not a service.
so this is almost like a renewal. This is Aurora of Central New York you've been working with.
I'd call it renewal, except we forgot to do it last year. And these are standard rates. They're non-negotiable. You don't have another vendor to choose from.
Any other questions, discussions? Hearing none. All in favor of HH1?
Aye.
Aye. Any opposed? HH1 passes.
Our second resolution is requesting permission to fill 2 part-time WIC peer lactation counselor positions. They are very part-time, approximately 10 hours per week, fully funded through our WIC program. It is a requirement of participating in the WIC program that we attempt to fill these positions.
Motion for HH2?
I'll move it.
Thank you.
I'll second. We have quite a bit of turnover in these. Yeah, we've been fortunate the last few times. It's been we try to get someone who has experience with WIC to fill these positions, and generally they have young children. If we have someone for 2 years, that's a long time, and we're glad for it when that happens.
Any other questions, discussion? Hearing none. All in favor of HH2?
Aye.
Aye. Any opposed? Passes.
HH3 is a request to fill the Director of Health Education and Public Information position, Health Department, following resignation. This was something that we had discussion about and was part of our budget. We would like to move forward with filling that one.
I have a motion for HH3.
I'll move it.
I'll second. Any questions, discussion?
Is
Go ahead.
this the position we utilized, for example, when COVID was in our midst?
No, this was part of the restructuring of the health department.
Okay.
And Legislator Daley?
I had a long conversation with Kathleen about this because I initially had questions as to, with this position being vacated, why she needed another director level over the health education piece to your department. Perhaps you could be looking at community health services then, kind of combining it, but I'm probably going to support this at this point. Basically, the information that I heard is, and you'll see it in the next resolution, you're not even sure if you're going to be able to fill the senior health educator because it has such specific criteria. You need a health education degree, X number of years experience as a health educator. If we were to look at this and you were to convert it to a supervising health educator, you'd have those same very strict criteria that you'd have to use to fill that position. Taking this position and putting it in out of the union and setting the minimum quals will open up a broader pool of applicants for you to supervise the numerous grants that you have in the health education work that's really, I didn't consider that in terms of thinking things were kind of top heavy. But if this position, you told me the senior public health educator is a $58,000 position. This starts at 69, so you would have to pay. This will just give you much more flexibility in terms of getting a qualified person that's not so strictly related to the criteria of a health education that is set by. Yes. So, I mean, my thought was I probably would have not supported this, but I feel more comfortable now.
Thank you.
And as I understand it, there's a lot of supervision built into this under the grant programs. Because so much of the health education is grant funded. And that comes with, that those are grants, that help offset state budgeted
Mandated
monies and mandated
You're
programs
correct.
in the department.
You know, it is something, and I don't want to over talk, but we've had a number of newer grants that have come in that are specific to our county to offset services like lead poisoning. And that requires people to do the work. Our staff are newer. Now, in part of my conversation that I had with some of you, we had taken a look at our health department staff, and of just the full-time employees, of which there are 37 within the health department of full-time. There are 16 of us who have been there more than 5 years. That's a lot of history that's gone. So a lot of our staff are not only newer to their positions, which we had a complete overhaul with our directors, right? So in the past couple of years, a couple people rose up through the ranks. A few people came in from the outside. Great talent, not a tremendous amount of experience working in this type of job. Particularly when they're filling our entry-level positions. For many of our staff, they are new to the workforce, not just new to the job. And so supervision and orientation and support, it's very time intensive, but it does reap the rewards because it takes so much time to recruit. We want to retain these people as well and have successful programs. So this is along those lines. And I appreciate the opportunity to have those conversations because I think it does help provide a little more depth of rationale.
Any other questions or discussion on HH3? All in favor?
Aye.
Aye. Any opposed? HH3 passes.
Page 4 is a request to fill either public health educator or senior public health educator within the health department. Specifically, this role will be funded through our Healthy Neighborhoods program.
A motion for HH4. Second?
I do have one question. Is there a big difference between senior and?
Yes. One's grade 22, one is grade 15.
I meant in responsibility.
The opportunity to be able to supervise. So with Healthy Neighborhoods, we use a lot of our fellows. So it's one more level of who's in charge when you go out in the field. Dollar amount wise, we do have that.
But if you can't fill the senior, you'll still be able to have a health education person.
Correct. Yes, but that's where it's really important, a supervisor for that unit.
And this is 100% grant funded through the Healthy Neighborhoods. Any other questions or discussion? Hearing none. All in favor of HH4?
Aye.
Aye. Any opposed? HH4 passes.
Page 5 is a request for us to enter into a contract with Vineski and Company for our required auditing and consulting services for our diagnostic and treatment center, which is our clinics that we do, like our immunization clinics. This is a request for a 3-year contract, which it's $250 more a year for these next 3 years. But prior to this, they have not asked for an increase for 7 years.
I'll move HH5.
Thank you.
Second.
Any questions or discussion? Hearing none. All in favor of HH5?
Aye.
Aye. Any opposed? HH5 passes.
We have all the resolutions for the health department. They have a few updates. Great. I shared with Heidi, and some of you might have heard, if you might remember, in December, I'd spoken with the HHS committee, the Board of Health, about eMedNey portal for Medicaid reimbursement that is used for our preschool special education was not functioning for us to be across the state. It wasn't for our county, but it was across the state. I'm happy to report that that issue has been resolved and it is working, and we were able to submit 3 months that were prepared, and now we're back on schedule for what we do. So we should be seeing some revenue come in there.
And we didn't lose any of our providers with them waiting for that amount of time for reimbursement?
Fortunately for this, unfortunately, it's the county only is the one who takes the hit. So providers are paid in the first instance by us, and then we can, when we claim.
Yes.
Yeah.
So that worked well in that regard. But related to that, when we talk about the early intervention hub,
Right.
that's been a tremendous issue for all the early intervention providers, service coordinators, counties that coordinate it. It's still an issue. However, things are getting better. I was just speaking with our director of that division, and she was saying that the calls between State Health Department, Bureau of Early Intervention, PCG, which is the group that wrote the software, they're continuing weekly calls through March. They're scheduled right now, and they try to talk about one topic per call. It's not taking 4 hours right now to input. It's still taking longer than it should. Our providers have been wonderful, and they've hung in there. To the best of my knowledge, we have not lost any providers. But one of the fallbacks, and I think this has to do with the ability for providers to get paid while the system is getting fully functioning and they're putting things in, is what the state requires of us now in our escrow account did increase. So previously, the state pays the early intervention providers, the county pays the state. So we have to put money in an escrow account every month, and it had been about $30,000. Now they're requiring $50,000 a month to stay on top of that. We're still only going to pay what is owed, and the providers have to back things up. But that was a leap. Is all related to this. On a different topic, H5N1 avian flu. There's been a lot of discussion about that. You probably saw in the news that there was a person who passed away as a result of that particular strain of flu. Nothing for us to do in New York State additional at the moment. It's really more surveillance.
Is this bird flu you're talking about?
This is the bird flu.
Okay.
Yep. That you worry about it not only in birds, but you worry about it going to other animals like dairy cows. And then infecting not only the animals, but people who care for them and work with them. So that's just, as we learn more that's pertinent to our geography, we'll certainly share more of that with you. But there has been discussion about how to do testing, where to submit testing, things like that, if that were required. And with our WIC program, tomorrow we'll start at our new offices in the town of Ira with the town offices. So the desire is for WIC programs to go off-site from their central area, particularly in Longer County, and to get out into the rural areas to engage with community members. Now, probably most of our community members work more remotely, but we certainly have some who will come in person. So it'll be interesting to see how well this goes, but the town was very receptive and very supportive. So we'll see how that goes, but I expect nothing but good things. And that would be once a month visit. We would
Legislator Daly has a question.
Is that the only offsite? I know years ago they had offsites.
We ran a church
while?
there. Oh, well, we're still in Moravia.
Okay.
So we're in Moravia at the same church at St. Matthew's in Moravia.
And you are now north. You just switched your location?
Correct.
Okay.
I had not been going north for a few months while we were finding and getting a contract in place.
Great.
And this is WIC related also. The WIC Association of New York State had sent this letter to the State Health Department with, advocating for some things, but this was an interesting statistic that I thought was worth sharing. From March 2020 to September 2024, the New York State WIC program has seen a 24% increase in overall program participation and a 36% increase in the number of children aged 1 through 4 who receive WIC benefits. I think that speaks to the program and how accessible it is, but I also think that speaks to the benefit it provides to families, and we're glad to be part of that. One other thing I just wanted to talk about was rabies. Rabies coordinator, we have some applicants and we will be setting up interviews for them, so we're very pleased about that. In the interim, we have staff members who are taking call after hours. It's our Director of Environmental Health and our Director of Community Health Services. And they're alternating week by week. Now we're glad it's the slower season typically in winter. But what I'd like to do is float this idea by you. We anticipate, if things go well, that we should be able to offer a job to a coordinator by the end of the month, right? We're going to go on best case scenarios. It's going to take some time to orient that person. It's a very part-time position. They'll need to work and learn how to work the programs and submit necessary information. So I'm going to speculate that they probably won't be independent for a couple months. So let's say February and March. What I'd like for consideration is to think about offering a stipend to our 2 directors taking the on-call during that duration. Rabies is a 24/7 response. During the office hours, our office staff covers that. But after hours is typically when we get more calls. And it could be the I woke up to the bat person who's panicked. But most concerning to us is someone who presents to the ER and is needing. It's a requirement that the local health department approves the administration of the RIG, the rabies immunoglobulin, and the rabies vaccine for the first session. And that is otherwise claiming can't be done. The hospital does it on our behalf. They cannot get reimbursement. But this is the case where whether it was a doctor's office that provided the RIG, or it's usually urgent care centers or hospitals. It's been 8 days. We've had a few after hours calls. We've had one that required rabies. What I am proposing is a lesser amount than what it would cost for someone to be on call. On-call rates are set by the contract. And it would average, and of course I wrote it down and I left it over there, I think. $243, I believe. And that is for the 5-night a week and the weekend call rate. And then you have to pay someone their hourly salary rate. I would propose a $200 a week stipend flat for whoever is on call that week, either our environmental health or our community health director. We do have the money in our budget through the rabies coordinator position at this point in time. And I'm throwing that idea out there for your consideration. And if you are open to that, I would look to bring a resolution forward in February to then in February and March. We would not ask to go retro in January. We would look to do it for February and March while we orient the new file. Or assume that we get that.
So currently now, when they're taking the on-call times, we're paying a rate that's set.
If I need to assign someone to take call, then that is a rate that is set. When we had a rabies coordinator, the vast majority of our calls at this point in time and this time of year are rabies related. There certainly are other questions that come through. Most of them are environmental health related, and sometimes when there's an outbreak, they're communicable disease or an incident related situation. So we do not have someone scheduled currently for on-call because that was something our part-time release coordinator would do. And our answering service would bring those calls over to that person.
I think the bigger issue has to do with the setting the stage for compensation of the non-bargaining employee who is exempt from overtime pay. And when you had a rabies coordinator, they were an hourly rate employee, and if they worked at night, you paid them the straight rate. Right now, you'd have to talk with HR and you'd have to get an opinion, but at this point, the non-bargaining are, until the handbook is changed, are eligible for up to 35 hours of rolling comp time. They can earn it, they can use it, they can earn it, they can use it. But I don't know of another, and I know you mentioned other employees non-bargaining have been stipend, but my understanding is that was when they did work outside of their own responsibility. So I don't think you've ever been compensated. Well, you couldn't anyway because you're appointed, but Eileen ahead of her as a non-bar. I think there's more discussion than just bringing a resolution and having us look at violating the non-bargaining.
And I would say this is somewhat different because it's not scheduled, right? We're asking someone to answer the phone.
You could ask one of your nurses and they'd be eligible.
Right, and we can pay them to do that.
Yes.
And they would be on call and it would cost a lot more money
Yep.
to us as a county. So that's an option. Yes. Yes.
It's just opening the
is.
floodgates for.
No, and
Yes.
I guess I think that's okay, right? I'm speaking only for the staff that I know in the health department. For what I've done in the past and what I know our staff do now, they make themselves very available. But I don't think it's fair to say, stay near the phone. Don't go out to a party, don't have a beverage, and respond to this call that comes through. I think I see the significance of the program. Also, those particular people have a knowledge base to a certain degree, they know how to prioritize, right? And not to say that other people can't learn that. So I don't want to be dismissive of that possibility.
And it would be,
I think it's worth considering.
Elaine,
nope, I'm done.
for you. Okay.
Anything else?
Any other questions? Thank you, Kathleen.
Great, thank you.
Christina. Now, Christine's agenda looks daunting, but so much of this is the typical January schedule of contract renewals. So I'd like to go through your resolutions first, and if you'd like, kind of went through and identified the numbers of the resolutions that refer to contract renewal.
Okay.
So I'd like to motion to bundle HH6, HH7, HH8, HH9, HH10, HH11, HH12, HH16, HH17. And is there a second? And Christine can talk about those contracts.
Sure. I group those together.
Okay. So if you'd like to talk about those contract renewals.
Okay, so HH6 is for the department to contract with Catholic Charities to provide called SSI maximization for safety net assistance recipients or temporary assistance to needy families recipients. The purpose of this program is to really provide some intensive support for clients of the department that have either been on SSI and maybe were incarcerated and lost the SSI during that time of incarceration, or lapsed with following through with the process of renewing. It's a kind of a daunting process to get on SSI, and it takes sometimes many years. This particular person that has provided the service for us through Catholic Charities has some expertise in this area of what it really takes to get someone connected to all of that system of SSI, the appeal process, the paperwork, the gathering of the medical documentation. And how it benefits DSS is we're able to be successful in getting someone through that SSI approval process. They are not on temporary assistance benefits anymore, and help save some resources for us. Want me to move on?
Yeah, and then we'll ask
Jump into
general
questions, okay.
questions afterward.
HH7 is for the department to enter into a contract with Catholic Charities again for the provision of supervised visitation services. This is a contract that we've had with them for a number of years, and the purpose of this contract is for us to have someone else besides the department staff that can provide supervised visitation for the children that are in foster care. There's a requirement for us, and in some cases, very specific ordered visitation by the family court judge for visitation to be provided to these families who have children that have come into foster care. It can be time intensive, it can be multiple times per week. It involves not only just supervising the interaction between the parent, caregiver, and the children, but also a component of this contract is for coaching that takes place, which is really nice because the parent, when they're there for family time with their child, can be given some feedback on things that went well, or maybe a different way to approach some struggles that they had with the child's behavior, or something that they did around discipline or food they provided, things like that. So it's the supervised visitation plus it's some real like parenting education and feedback. HH8 is for us to enter into a contract, DSS to enter into a contract with Cayuga Centers for diversion management. This is one of a few contracts that we have with Cayuga Centers. This one in particular focuses on youth that are the ages of 12 to 15 who have had some sort of behavior that could potentially be a criminal offense if they were of an age that they would be able to be charged with that crime. It's an intensive case management program that really kind of focuses on pro-social skills and school, successful school attendance, performance. In some cases, it's working on connecting them to things like mental health, substance use treatment, things like that.
And it's essentially a diversion program away from family court at this point,
Correct.
which would be very expensive
Yes.
if those youth landed in residential care or
Correct.
without the case management. Yep.
Have you
Legislator
done
Daley?
you have an RFP, these kind of contracts, they're quite expensive because we don't have a ton of vendors, is that?
Yeah, we don't have, I don't know who else would provide the service to us. Some case management services for PIDS type youth provided by another voluntary agency in the community, but they do not want to do it any longer. So right now we do have most of our services with Cayuga Centers. One of the things that we talked about doing is taking a look at these contracts that we have this year and getting a jump on getting with Amanda to talk about maybe there are some potential
Place for cost savings?
with RFP, RFQ process. So we're gonna talk about looking into that.
There's millions of dollars going into
Yes.
preventive service, right? Yep.
So that was HH8. HH9 is another contract that we have, we're looking for with Cayuga Centers. This is also something that we've had. This is not a new services or a new contract. It's a large amount of money, but it does provide a number of specific programs. And on the resolution, there's a listing of the programs that are provided within this $550,000. Family preservation is one of them. That is a It's actually 2 workers that have a very small caseload of 2 to 3 cases. They work for a short period of time, about 4 to 6 weeks with a family. And family preservation is really targeted to work with families whose children are very close to having their children come in to the system through Child Protective Services. So when we have a family that's really struggling, and it can be any age child, it doesn't have to be little kids, it can be older kids as well. We make referrals to this program, and it's kind of like the whatever it takes program as far as like case management. They depending on what the issue is, what kind of struggles the family's having, they tailor their services to really target that whatever that need is. So it's not, one, kind of size fits all as far as the case management. It's really whatever's going on. They're trying to do an assessment to figure out what that is and try to address those issues during that short period of time to prevent the child from coming into foster care. The next one is family support program. That's similar to family preservation, but it's less intensive, and it lasts for a little bit longer period of time. The children don't need to be at imminent risk of coming into foster care. Sometimes we use family support program as a step down from the family preservation program, because the 4 to 6 weeks that they had that intensive services, they continue to need more help and support after that period. So we can kind of step them down into this less intensive program and have these service providers in the family in working with the family for a longer period of time of about 4 to 6 months. The enhanced foster care support program is something that we utilize in order to really provide supports, concrete supports to foster parents that are really struggling with maintaining a placement of a child. When foster parents that are certified by DSS call us and say that they're struggling and they want this child removed, we're going to have to look for another foster home. We might have to look for a higher level of care, which can be very expensive. And so this program, through enhanced foster care support, puts a caseworker, case manager from this voluntary agency Cayuga Centers in the home to really help provide supports to the foster parents so we can try to preserve the placement. And the last one is multi-systemic therapy. That is a clinician. It's two full-time therapists that work with the family for up to 6 months. And it's children that really have some specific behavior in the community that's pretty intensive and difficult to deal with, either out in the community or in the family's home or even in the school. So these are older children that are really struggling. And again, like you said, if things don't improve, we could be looking at the child potentially coming into foster care through the juvenile justice system. And this is a way to try to avoid that if possible.
I was just going to say, I'll give a personal antidote that, as you know, I worked with you in your department 20 plus years ago as a foster care provider to a very at-risk older teen, and managed to maintain her through high school for 18 months. But boy, if I had had some of these support services, I would have been a much calmer person at the time.
Yes.
Foster care mother. Yeah. Legislator Daley.
Are any of these programs eligible for Medicaid reimbursement?
Yes. So with this contract, the $550,000 is the maximum amount that the department will spend. The cost, the budget that Cayuga Centers provides to provide all of these services at this level with the number of workers per program is actually much higher. But over the last couple of years, they have done a really good job of figuring out what they need to do to bill Medicaid for reimbursable services. Get the paperwork in order that they need to be able to document that they, are eligible for those Medicaid reimbursable services. So it's, we're actually getting more than, the $550,000. We're actually getting more services. It costs more money for Cayuga Centers to provide those supports, but we're getting a break because of the Medicaid.
They take the Medicaid billing
Yep.
off.
They can't double dip.
Yep.
So they're not allowed to bill us on top of the Medicaid. So anybody that's getting the Medicaid billable services, we're not being charged on top of that. But what's left for us to pay is the $550. It's actually A couple of years ago, it was quite a bit more money. It was over $800,000. So we knocked that back down. And this it's good to note too, the amount that they came in with for this year for 2025 is the same as last year. So this contract amount actually is not going up for 2025. It's the same amount as it was in 2024. You ready? Sure.
Yeah.
That's number 10, HH10. This is for a contract with Cayuga Centers for the provision of restorative case management services. Very similar to the DCM services. It's a case manager that's home-based that works with families. There are about 40 cases, 40 youth that are served at one time. This is pretty much like community members that are struggling with children in their own home, therapists. I mean, these are the supports that we put in place to help, with managing youth that are really struggling in different areas. It's home-based, also school visits. It's really the old PINS diversion that we used to have that is now called restorative case management. And again, this is to help forestall foster care placement.
Do you have to vote on any of these yet, or
We're just going to go through them all and
Okay,
then
okay.
vote.
Good.
Almost there.
Yep.
Okay, am I doing 11?
11.
Yes, 11. Contract with Chapel House Temporary Homeless Shelter for Men. So this is the Franklin Street Shelter. We are looking to contract with them again for the same rate as last year, $98 per night, which includes the actual shelter stay and includes case management component as well. No rate change in 2024. Our ability to have men housed there is usually between like 8 and 10. We have there because they also have a contract with veterans, the Veterans Administration. So we don't, I don't know that we've ever had all 15 beds, but we have had usually up to 10. Number 12 is for us to enter into a contract with the Children's Home of Wyoming Conference. This has been a contract that we've had for a little while. We actually did a few years ago enter into an RFP, and Children's Home of Wyoming Conference was the chosen recipient of the contract. This is really an embedded program. Say embedded, we don't really have a building right now, but it's embedded in our own services area. They're workers that they work right alongside the DSS staff. They're right there with us, working on recruitment, training, and retention of foster parents. These workers, there's 3 of them. There's 2 workers that actually are the trainers of the foster parents. They do recruitment events in the community. They answer phone calls from people that are interested in learning more about foster parenting and coming our way as foster parents. They complete like I said, the training for them. That's a real, comprehensive training to help them understand what they're getting into when they foster children for DSS. They complete any recertification for foster parents that go through past the year. And then we also have a worker that is kind of like the other worker we talked about, enhanced foster care support. It's a worker that really will help provide supports in a concrete way to foster parents when children are placed in their home. So sometimes when we place children in foster homes, foster parents it might be a first placement for them, or the child might have some challenging issues around health issues or behavior issues. And this is a peer. It's a peer who has experience in parenting as a foster parent and can really just be there for the foster parent in whatever way that means. And sometimes it's sitting with them, through some difficult issues with the child. It can be helping provide transportation. It can be helping them learn where different supports are in the community. It's nice to be able to offer that to foster families that are new to us, but also sometimes we use it for foster parents that are veteran foster parents for specific reasons. So it's worked out nicely.
And what I remember about Wyoming Conference from my own old human services days is that this was one of the first and continues to be one of the most embedded programmatic agencies around the use of very effective evidence-based programming.
They've been good to us. Again, this is also, the contract is, I believe it's just about the same amount of money as last year.
Let me skip down to HH 16.
HH 16 is to contract with the Community Action Program, CAP, for the provision of non-residential domestic violence services. The Department of Social Services is required to provide non-residential DV supports for people in Cayuga County. They provide supports like victim advocates. They go to court with folks that have been involved in domestic violence situations. They run a support group. They answer questions for people that call in and need support. They provide education. So these are really the non-res DV services that they provide. And like I said, we are required to provide those services in the community. And the last contract is for us to enter into an agreement with Q-Track. So Q-Track is our software service that helps us with visual queuing and in the waiting room. And it's like an appointment platform that we have. We worked with IT a little bit on this one because we don't have a place really to have it running right now, but we're going to need it coming into this year. We consulted with Tom and his staff, and we were told that we need to do the full year contract. If we don't have a contract from January until December, we would essentially lapse on the contract and have to start up again with them and incur some startup costs. And it would end up being more money if we did do that, if we approached it with just dropping off with them and starting up down the road. So that was the decision, was to continue with the 12 months. They did actually give us a break. So there is an adjustment to this that I can let you know. After talking with them, they said that they would cut our costs a little bit for January and February and cut our cost in half. So there's some number changes on here, and what it would essentially amount to is the monthly licensing line would change to $482.50 per month. But in January and February, it would only be $241.25. And then the phone number monthly maintenance support, it's actually $5.43 flat, not per month. It's just a $5.43 fee. And it would amount to a total contract amount of $5,313.01 per year.
Thank you.
We've ordered the kiosk that we need. The old kiosk in our county office building is not able to get, so we needed to order a new kiosk. So we actually have ordered a new kiosk because we'll need that in order to run this.
Are you asking us to amend this resolution?
Well, these amounts are wrong. So I mean, that's what we would need to do if.
Mr. Lawyer? What do you say?
Should we pull this one from the bundle for an
You
amendment?
can pull it from the bundle.
Okay. We will pull 17 from the bundle for amendment. In the meantime, then, any questions or discussion on the bundle of HH 6, 7, 8, 9, 10, 11, 12, and 16?
I'll move that.
We have
Okay.
already. Any discussions or questions after the presentation? Hearing none, all in favor?
Aye.
Any opposed? It passes. So we'll stay here with HH 17, where thing, phone number, monthly support. This either total amount or the January, February 2025 amount.
It might be easier just to have it be a total contract amount of the $5,313.01. don't know.
5,300.
$5,313.01
Got it.
per year, for the year. If you're okay with that.
And there's no reference to that now, right?
Right, there's no reference to
Right,
that
there isn't.
now. So as an amendment, I would add, whereas these expenses budgeted for the 2025 Department of Social Service budget of $5,313.01 are reimbursed by federal and state funds at 62%. Now therefore be it. Did you catch that? It's in the last whereas, Fred.
Yes,
Does that make sense to add it there?
that's a perfect sense, place to put it.
Can I have a motion on that amendment?
Motion to amend?
I'll second.
All in favor
Aye.
or any discussion on the amended?
Does this have to take the month out of the phone number? Or it didn't, I don't know.
All that's coming out.
That is coming. Oh, it
That's all
is.
gonna come out. It'll
right.
just have the
Going to
53,
have the annual.
one.
Okay, great.
Any other discussion on the amendment? All in favor of the amendment of HH 17?
Aye.
Any opposed? So HH 17 as amended. Can I have a motion?
I'll move it.
Second?
Any discussion, questions about HH 17 as amended? Hearing none, all in favor?
Aye.
Aye. Any opposed? HH 17 says. So now we'll go back. Fill in some spots. Let's start with HH 13.
Okay, so HH 13 is a resolution looking to fill 3 full-time caseworker positions in DSS. Right now, Department of Social Services has filled all the positions that we have had permission to fill. We have not everybody seated in that position yet, but we have 2 people starting on Monday. We had 2 people start Monday this week. We have 2 people starting on January 21st, 25. Another one starting on February 3rd. So once those folks are all in, we will have filled all of the positions that you have given permission for us to fill. We still have 3 more vacant caseworkers that I'm seeking to fill tonight. One of them left for a different job. And, honestly, her feedback was that this situation with not having a office is not conducive to her wanting to stay. Just wasn't a good match for her style of work. Which for some, we know that for some people, it's not easy. And another one, just moved out of state. She made a life decision, and then the other one went to work for the state. So those are really the reasons that those 3 that we have are going to need to fill have been vacated.
Motion for
I'll move
HH
that.
13?
I'll move it.
I'll second.
Any discussion or questions on HH 13?
Good luck.
These are
Legislator.
reimbursable, minimum of 62%.
Yeah, Legislator. Davis.
Nope, doing all the mandated work of the department at this point. If you can keep them filled, good luck.
Yeah, we've had, yes, and so this is good that we have these 5 starting. I mean, I've said, so many times that you've heard me say that, we have a lot of new staff, and this kind of shows you that, we have these 5 that are coming in that are brand new. We'll be looking to bring in 3 more that are brand new, getting them through the training cycle, to be able to kind of function, more independently. It takes a long time. And, I'm pleased that we've had some success with people accepting offers, and that we've had candidates that have come forth and applied. So that's a good thing. And it's, I'm going to a webinar that's through, NISAC tomorrow morning, that's about this very topic of caseworkers and the difficulty that around the state people are having. I don't know if anybody else got the invite to that webinar, but I'm hoping that, maybe we'll hear something a little different about some strategies.
Christina.
Mhm.
Are you finding, as Kathleen Cuddy did, that these new caseworkers, are they coming in also as new to the workforce? They tend to be young people, almost new to the workplace, or is it just a
Definitely have
mix?
some of them. We definitely have some folks that are for Veteran and Human Services, in particular this group that we hired recently. We've had some that have some pretty sound experience, which is nice. But we have had a lot that have been, they just don't have a lot, which makes it even more intensive as far as just like building them up with the knowledge of, you know, the work and the, you know, what it takes to work with families in their home and the issues that, you know, DSS deals with around the issues of child welfare and foster care preventive services.
Any other questions or discussion for HH 13? Hearing none, all in favor? Aye. Any opposed? HH 13 passes. So we'll move to HH 14.
Yep, so HH 14, we're looking to fill a paralegal specialist position in DSS.
Move it.
This is your full-time paralegal. You graciously gave up some paralegal work in the recent budget process.
This is a full-time.
Fred, do you have extra time?
Yeah.
It's a joke.
Saturday and Sunday.
Yeah,
Anything else with that?
I'll move that. It was moved and seconded.
It has been, yeah.
Okay.
Any discussions or questions about the fill of the paralegal?
No.
Hearing none, all in favor?
Aye.
Any opposed? HH 16 passes. I'm sorry, that was HH 14 passes. HH 15.
Last one is HH 15. This is for accepting Safe Harbor New York funding and contracting with Booker T. Washington to provide services that are specialized in working with commercially sexually exploited children, trafficked and at-risk youth. So they have done this for a few years for us, and it really involves a lot of like training. So they do training with police agencies, they do different trainings at school districts and in schools to help bring awareness to the issue of trafficked youth and what to look for and supports that are out there. We also connect, if a youth is identified, they can help connect that youth to services. They keep statistics on the trainings that they've done, the referrals that have been made for specific youth, and what those services were that were provided to the youth that we have to report back to the state. So it's a small amount of money, $30,000, but I do think that it's been useful in helping people sort of, continue to have the awareness like brought to them that, these are the things that you should look for. And just, helping people understand that it's not necessarily, what some people think of as trafficking. It can be a little bit more, subtle, like some subtle things that happen that are things to look out for when it comes to children being exploited in this way.
Can I have a motion for HH 15?
I'll move it.
Okay, we have a motion and a second. Any
If you
questions?
didn't pass this money through, the department would have to do this?
The safe harbor money, yeah, we would have to,
Do it
Yes.
with your own
yeah,
staff?
our own caseworkers, and
Yeah.
that would be tough because it is, there's a hotline.
Yep.
So it's nice to be able to have them set forth and be able to do that.
Any other questions, discussion? Hearing none, all in favor of HH 15?
Aye.
Aye. Any opposed? HH 15 passes. Okay, do you have a report for us?
Just a couple of updates. We have, as of 12/20, that was actually our last census of our emergency housing population. We had 30 families that we were housing and 113 singles. I don't know if it's gone up in the last few weeks, but we definitely are in a cold snap, and it might have gone up a little bit more, but things are remaining pretty steady, I guess. It's any sharp drop.
30 families is a lot, right?
30 families is a lot.
We had 34 last month, so some were housed.
Yeah, and every week things like shift a little bit, but no huge drop offs that we've seen. I was hoping that I would have a little bit more specific information for you tonight about the number of families that we've served through the rent supplement program and the rental arrears. Send that out. I'll send that out by email. So you can have that, because I told you that I would bring that information to you in January. I haven't been able to get it yet from the staff. But we have been utilizing the program. We have a few weeks ago, I had heard a few, we talked about some cases, some specific cases, and it was helpful in helping some families find permanent housing with that support or avoid eviction by getting the rental arrears. So that's a good thing. But I'll give you some more details on how many families have been helped with that so far. Other things that are happening at DSS, we are starting to, we're getting prepared for some case review type of things that are happening in child welfare. They'll be coming out and reviewing some of our cases to see how our practices around meeting the regulations and they'll be reading cases back on our practice. In one particular program area, they're actually going to be interviewing foster parents, foster children, the caseworkers. So that's coming, and that'll be something that we haven't had to go through in a little while. So it'll be interesting to see, what their feedback is. And, as in all audits, they definitely always give some developmental feedback. But, I think that they'll see some things that we've done too over the years to kind of improve our service delivery. And, we have a lot of, kind of creative solutions here. And we definitely have, some good supports in some of these contracts that other communities really don't have. And so I think that typically that kind of shines through, with that. Our system of care is a big one that, is often recognized as something that our community is really strong on, that other communities haven't been able to put together in such a kind of organized and long-term way. So, we have that to be to kind of promote and, kind of shine. So looking forward to that. And, getting all this hiring done. I mean, that takes a lot of time. Anyway.
Really are. Thank you.
Okay.
Thank you very much, and Happy New Year. Any other questions for Christine before she leaves?
No.
Okay.
Thank you.
Lauren Walsh. With our Community Mental Health Center. Just have two, HH 18 and 19. We'll finish our resolutions for the night.
Yes, so 18 is about authorizing the acceptance of funds from the Office of Mental Health, and that's for student loan repayments for our nurse practitioners as well as social workers. So we put it out there to our staff and whoever is eligible, and also depending on their situation wants to apply for this, they can get $30,000 towards their loan repayment. It's $10,000 each year for 3 years. We've been working with the legal department on the contract with all the specifics about it, because if they leave, they have to repay the money, and kind of how that's all gonna look and works. But I think we're good on it now.
We're good on that.
So that's all situated. So this would be accepting those funds for those individuals.
So this clearly is helpful with retention.
Yes, yes.
And you won't know how many people are eligible, just depends on how many apply.
So I think they're about to be on their 5th round of this.
Oh, okay.
So each round, if we have new staff, we offer that to them as an option. And we do tell our new staff that are coming on that this would be an option for them to get their loans repaid up to that amount.
Great. Can I have a motion for HH 18?
Can I ask a question?
Oh, yes.
Lauren, is that just a 3-year commitment on time?
Yeah, they have to be working here in order to get those payments. So it ends up being it's $10,000 per year. So it's 3 year. Yeah.
Thank you.
Is this new?
It's new since kind of COVID, but we haven't had we haven't had many people take us up on that, whether because they have public service loan forgiveness or whatever their loan situation is. Some people haven't, gone forward with applying for this, but now we have people that are taking it.
This is kind of public service loan forgiveness because we're county mental health.
Kind of, but this is specific OMH, Office of Mental Health, that this is their way of hopefully retaining staff and keeping them in the places that they are instead of people just going to different places and not staying where they are. And there's a shortage of
And
those.
getting them to work for you because they have to stay working to be
Yes.
eligible
Yes.
for this loan repayment.
Yep. So that's part of the terms and conditions of the funding.
And since it's a program of OMH, it doesn't impact or doesn't cross over with whatever like income-driven plan or something they might have with the Federal Department of Education.
And there's no implication for our budget.
Right.
Right.
Great.
Any other questions? Discussion? Hearing none. All in favor of HH?
I'm not sure I heard a motion. Maybe I missed it.
I'll move it.
Thank you.
And I'll second.
Okay.
Thanks.
Any other questions, discussions? Hearing none. All in favor of HH 18?
Aye.
Any opposed? Passes.
HH 19 is accepting funds from the Moravia School District. So I think you've heard me talk about it in the past about our SAMHSA grant that we got that's really about putting therapists in our rural districts to do DBT in schools. So Moravia, we actually applied for that grant and Moravia applied for this grant at the same time, not thinking that both of them, we'd get both of them. So we've kind of separated those grants, but they're very similar. So Moravia is actually going to be reimbursing us for a therapist's time in their school district to provide individual DBT treatment and other treatment for their, it's basically eventually going to be a satellite office, but they're going to be able to provide individual therapy to referred children from that school district as well as groups. And they are also providing universal DBT skills. So they're providing their middle school students, all of them will learn the universal skills in their classes. So it's pretty cool. And there'll be a ton of data collected for this. So I'll make sure that we can present that to you when we kind of have the details of how much of a difference this is making in the schools as they learn these skills that they can apply to just life as teenagers. So this is just, we are getting reimbursed for one of our therapist time in the district.
That means that when you applied for and received, you've got a little stretch in terms of what you can do with it.
Yeah, so we applied that to the other school districts and then this is specific for Moravia. So we separated the two when we found out we got both sources of funding.
Any questions, discussion? Hearing none. All in favor of HH 19? Aye. Any opposed? HH 19 passes. You have a report for us?
I'm still getting caught up in that.
Just back. Welcome back.
Yes. But no, one of the biggest things is, we've started to move forward with our new electronic medical record. So there'll be weekly calls and a lot of change for our staff. So wish us luck with this, but ultimately it's going to be easier for everybody in the end. It's just going to be a lot of change, a lot of learning. So that's our big project that's starting to amp up now. That's a big one. But yeah, go ahead.
And this is the same new software that's going to allow us eventually to get rid of
A big portion of our billing.
right.
So we'll be able to kind of revamp that department as well and probably don't need as much there.
The one we had more than a little conversation with while you were
I know.
on maternity leave.
Maureen got to do that for me, right?
Yeah.
Yes, but that's the biggest update. I don't have too much else, but I'm sure I'll have more for you next month.
Welcome back.
Thank you.
And Brenda, I made wait to the very end, who has no resolutions. I should have gotten you up here more quickly. I'm sorry.
Way to end.
Got a report for us.
So with no resolution, so I'll just talk a little bit about my report.
Yes.
Okay, all right. So I just wanted to highlight a couple of things. The first one is on my report about the Office for the Aging New York Connects No Wrong Door program. And this is basically our intake and assistance program, but more in depth than what we used to do years ago. Because once the staff identify any particular needs or concerns, they're going to help people walk them through the different applications, different programs, eligibility, So they're doing a lot of screening, they're identifying programs people are eligible for, they're printing, providing, and assisting with applications. They're following through if there's problems with the applications. They're helping people understand what's available to them and what's not available. There's a lot of confusion out there about, what people might be able to receive and what not. Even as basic as what's the difference between Medicare and Medicaid, very basic question, a really big question, makes a difference on the services and programs that are available to people. So this year we served easily over 100 people a month in that program. And these types of calls are anywhere, and interventions are anywhere from half hour to 45 minutes to 2, 3, 4 hours of assistance with individuals, and sometimes longer, to help them obtain the assistance that they need. So that we've been utilizing or doing this program now for probably about 10 years. And our staff have had to go through a recent training for that. That was, one section was 35 hours of training, and another section I think was around 20 hours of training. So it's certainly a very in-depth training and very specific expectations of our deliverables and what we'll be doing in that program. So I wanted to mention that. The other thing I wanted to highlight is it's recently been announced that in New York State, over 1 million people have been determined eligible for the Medicare Savings Program. The Medicare Savings Program is one of the first programs that our New York Connect staff, or any of our staff really, when they have a contact with any individual who approaches our office for any type of need, one of the first things they try to do is get a little bit of information in addition to why they're calling, what their problem is, kind of what their need is, what their strengths, weaknesses are, is a little bit of information about finances. Because we want to screen individuals for the Medicare Savings Program. If they're eligible for that program, it puts $2,200 a year back in their pocket. So for low, moderate income individuals, that can make a significant difference. The income limit for that program for one individual is $2,355 a month. And for a household of two, a couple, it's $3,189 a month. So it's kind of a relatively generous program, makes a big difference. Sometimes individuals are not eligible for an aid through our programs or an aid through Medicaid because their income is too high. But if we can put $185 a month back in their monthly income, sometimes they can then afford to pay for a private aid to come in and do what they need to have done. So this program is pretty helpful, and a lot of individuals are very happy to hear about it and find out how easy it is to apply for, because we have a great working relationship with social services. The Medicare Savings Program applications are pretty straightforward. We get those off to the Medicaid office. They process them pretty quickly, and it's great. The additional piece I wanted to
Is that the monthly, like $185 Medicare contribution that gets picked up by Medicaid? Yep. If you qualify financially?
Yes. Yep, so it puts that $185 back in their Social Security check every month. In addition to that, most people who are eligible for that are also going to be eligible for the Extra Help Program. And that is a program for individuals that have Medicare Part D prescription coverage, and it reduces their copays down to less than $12 for every prescription. I don't know this year's actual copay for that, but it's on average saves individuals who have some significant prescription costs. It saves them over $5,900 a year. So I just wanted to highlight two of the programs that come out of our No Wrong Door, New York Connects program, as well as our High Cap program. Some of the key things we try to do is help people access these kind of low hanging fruit, but big impact kind of eligibility. So that's really all I have.
Just have a quick question about the Go-Go Grandparent Program. This is a pilot, and what year are we in the pilot?
I don't know if New York State, who is actually providing it to us, considers it a pilot, but they have told us that it expects it to continue. And we have been authorized for another $20,000 of rides for 2025.
And the grandparents or our elders, in the community, they arrange and they use the application themselves. Correct.
So in order to take advantage of this coverage for the cost of the rides, they need to register through our office. And most people prefer that to kind of understand it, to have somebody else over, kind of watching over, making sure everything's great. The other advantage of the GoGo transportation is it does not require a cell phone or any internet. So sometimes people utilize us to arrange both their transportation there and their transportation back from their medical appointment. Some people, we set up the initial one and then they have the GoGo phone number to call if they want to go back when they're ready to go back home. The advantage of that is at that point, it's simple because they call an operator who can see where they were dropped off and understands where they need to go back home. It's very straightforward. Yeah, I hope to see it used a lot more.
Yeah.
Here.
Yeah, I've seen, that you've been pushing this in the community and actually had a constituent call about what she read in the paper and.
It's been great. So, it's still got we had somebody in Locke who needed a ride at, I think, 7:30 in the morning on one of our first snowy days. And none of the Uber drivers were willing to pick that ride up. So we are encouraging people to have a backup plan. In this case, the person ended up rescheduling their appointment. So, it is a dependent somewhat on what availability there is with the rideshare drivers. But the fact that the folks in Locke have made it to Ithaca for multiple appointments over the past year, this one instance where they couldn't get the ride at that hour of the morning in snowy weather, it's kind of not so bad, I hope.
And it's not unusual for Uber availability, right? Especially in small rural areas.
Correct.
And have the availability is remarkable.
Yeah. The last thing I just want to mention is 23 was a very rough, very hard year for us. We had very short staffing and we had the fire happened and in the building. And so 24 was been a rebuilding year. And 24 was actually our 50th anniversary as a Cayuga County Office for the Aging. So finally, 25, we're going to celebrate. So we're not exactly sure how we're doing that, what we're doing yet, but we're looking forward to being able to go back and look at where we started. When I started in my office, I think I had every original document from the 1974 to the current when I started. So I was able to keep some of those things. We have some pictures. We have, I believe, the original budget, the original resolution or paperwork of the office. So it's been kind of fun to go back and look at some of that. And we'll be sharing that with the community to celebrate.
Look forward to that. Thank you. Any other questions? Thank you. So I'm at this point would look for
Motion to
a motion
adjourn.
to adjourn.
Move it.
All in favor?
Aye.
Bye.
Thank you.
Yeah, point.
All right, yeah, let me know.
All right, if I can have your attention,
Yeah.
department heads, we apologize. We do not have a quorum for JPS. All resolutions will be pushed to the Ways and Means meeting, which is the third Tuesday of this month at 4:00. You can go first, Brett.
Thanks.
Yeah.